Pass your exam with mental health screening tools practice. Question 1. When caring for a patient with major depressive disorder prescribed an MAOI, what type of food should the nurse educate the patient to avoid? Option A. High-protein foods. Option B. High-fiber foods. Option C. Tyramine-rich foods. Option D. Low-fat foods. The correct answer is option C. Tyramine-rich foods. Patients prescribed MAOIs need to avoid consuming tyramine-rich foods as these can lead to hypertensive crises. Tyramine is found in various foods like aged cheeses, cured meats, some types of beer, and fermented. Question 2. Which characteristic identified during an assessment serves to support a diagnosis of disruptive mood dysregulation disorder? Select one that doesn't apply. Option A. Female. Option B. 7 years old. Option C. Comorbid autism diagnosis. Option D. Outbursts occur at least once a week. The correct answer is option C. Comorbid autism diagnosis. Characteristics such as age, frequency of outbursts, and occurrence in multiple settings support a diagnosis of disruptive mood dysregulation disorder, while comorbid conditions like autism can coexist with. Question 3. Which activity is most appropriate for a child with ADHD? Option A. Reading an adventure novel. Option B. Monopoly. Option C. Checkers. Option D. Tennis. The correct answer is option D. Tennis. Children with ADHD often struggle with sustained attention, impulsivity, and hyperactivity, making it essential to select activities that align with their neurological needs while minimizing frustration. Tennis D. Question 4. A client is diagnosed with somatic symptom disorder. Which question will help the nurse develop nursing diagnoses for this client's plan of care? Option A. Are you satisfied with your appearance? Option B. Do you take medication for anxiety as prescribed? Option C. When did you last feel detached from your environment? Option D. How long have you had these memory problems? The correct answer is option B. Do you take medication for anxiety as prescribed? In clients with somatic symptom disorder, it is crucial to assess their adherence to medication for anxiety as prescribed. This question helps the nurse understand the client's treatment compliance, which can impact. Question 5. A patient with post-traumatic stress disorder, PTSD, is experiencing flashbacks. The most appropriate intervention is to: Option A. Encourage the patient to talk about the trauma. Option B. Help the patient reorient to the present. Option C. Leave the patient alone to process the flashback. Option D. Remind the patient that the flashback is not real. The correct answer is option B. Help the patient reorient to the present. When a patient with PTSD is experiencing flashbacks, the most appropriate intervention is to help them reorient to the present. This intervention can assist in reducing the intensity of the flashback and providing a. Question 6. What assessment question will provide information to the healthcare provider regarding the effects of a woman's circadian rhythms on her quality of life? Option A. How much sleep do you usually get each night? Option B. Does your heart ever seem to skip a beat? Option C. When was the last time you had a fever? Option D. Do you have problems urinating? The correct answer is option A. How much sleep do you usually get each night? The correct assessment question to understand the effects of a woman's circadian rhythms on her quality of life is to inquire about her sleep duration. Circadian rhythms significantly influence sleep patterns, so. Question 7. A patient with major depressive disorder is started on a tricyclic antidepressant, TCA. Which common side effect should the nurse educate the patient about? Option A. Hypertension. Option B. Diarrhea. Option C. Dry mouth. Option D. Weight loss. The correct answer is option C. Dry mouth. The correct answer is C. Dry mouth. Dry mouth is a common side effect associated with tricyclic antidepressants TAS. TAS block acetylcholine receptors, leading to anticholinergic effects, such as dry mouth. Question 8. Which statement made by the patient demonstrates an understanding of the treatment of choice for patients managing the effects of traumatic events? Option A. I attend my therapy sessions regularly. Option B. Those intrusive memories are hidden for a reason and should stay hidden. Option C. Keeping busy is the key to achieving mental health. Option D. I've agreed to move in with my parents so I'll get the support I need. The correct answer is option A. I attend my therapy sessions regularly. Regular attendance at therapy sessions is a crucial aspect of the recommended treatment for managing the effects of traumatic events. Therapy provides a safe space for individuals to process their experiences. Question 9. In treating social anxiety disorder, which medication is commonly prescribed to patients with this condition? Option A, methylphenidate. Option B, sertraline. Option C, lithium. Option D, haloperidol. The correct answer is option B, sertraline. Sertraline is a selective serotonin reuptake inhibitor SSRI commonly used to treat social anxiety disorder. SSRIs are a first-line pharmacological treatment for social anxiety disorder due to their effectiveness in. Question 10. A patient with panic disorder is prescribed a benzodiazepine. The nurse should educate the patient that this medication is typically used for option A, for long-term maintenance therapy, option B, as a first-line treatment, option C, for short-term use due to the risk of dependence, option D, to treat depression symptoms. The correct answer is option C, for short-term use due to the risk of dependence. The correct answer is C, for short-term use due to the risk of dependence. Benzodiazepines are usually prescribed for short-term relief of anxiety symptoms due to the risk of dependence. Prolonged use can lead to. Question 11. Tammy, a 28-year-old with major depressive disorder and bulimia nervosa, is ready for discharge from the county hospital after 2 weeks of inpatient therapy. Tammy is taking citalopram, Celexa, and reports that it has made her feel more hopeful. With a secondary diagnosis of bulimia nervosa, what is an alternative antidepressant to consider? Option A, fluoxetine, Prozac. Option B, isocarboxazid, Marplan. Option C, amitriptyline. Option D, duloxetine, Cymbalta. The correct answer is option A, fluoxetine Prozac. Fluoxetine Prozac is a suitable alternative antidepressant for Tammy due to its approval for the treatment of bulimia nervosa. It belongs to the selective serotonin reuptake inhibitor SSRI class of. Question 12. A patient with bipolar disorder has been prescribed lithium. Which dietary advice is important for the nurse to include? Option A, avoid foods high in tyramine. Option B, maintain a consistent salt intake. Option C, increase protein intake. Option D, avoid foods high in fat. The correct answer is option B, maintain a consistent salt intake. Patients prescribed lithium should maintain a consistent salt intake to prevent fluctuations in lithium levels. Salt intake can impact lithium levels, and sudden changes in salt intake can affect how the body absorbs. Question 13. In what order should the following goals be approached for a client being treated for alcoholism? Option A, learning about dependence and recovery, abstinence and development of a support system, attaining physiological stabilization, developing alternative coping skills. Option B, developing alternative coping skills, attaining physiological stabilization, learning about dependence and recovery, abstinence and development of a support system. Option C, abstinence and development of a support system, attaining physiological stabilization, learning about dependence and recovery, developing alternative coping skills. Option D, abstinence and development of a support system, learning about dependence and recovery, attaining physiological stabilization, developing alternative coping skills. The correct answer is option B, developing alternative coping skills, attaining physiological stabilization, learning about dependence and recovery, abstinence and development of a support system. When treating a client for alcoholism, it is important to follow a structured approach to maximize treatment effectiveness. The correct order of approaching goals is to first help the client in developing alternative. Question 14. Why is it important to establish a contract with a client with an eating disorder at the beginning of treatment? Option A. The client and healthcare provider form a partnership that is challenging for the family to disrupt. Option B. A collaborative approach to treatment planning ensures that both physical and emotional needs will be addressed. Option C. Involving the client in decision-making enhances the feeling of control and fosters cooperation. Option D. Permission for refeeding is crucial as it can have adverse effects. The correct answer is option C. Involving the client in decision-making enhances the feeling of control and fosters cooperation. Establishing a contract with a client with an eating disorder at the start of treatment is crucial to involve the client in decision-making processes. By engaging the client in decision-making, it enhances their. Question 15. In the care plan of a male patient diagnosed with a dissociative disorder, the nursing diagnosis of ineffective coping is included. Which behavior demonstrated by the patient supports this nursing diagnosis? Option A, has no memory of the physical abuse he endured. Option B, using both alcohol and marijuana. Option C, often reports being unaware of surroundings. Option D, reports feelings of not really being here. The correct answer is option B, using both alcohol and marijuana. The correct answer is B, because using substances like alcohol and marijuana can be a sign of ineffective coping mechanisms in patients with dissociative disorders. Substance abuse is often used as a maladaptive way. Question 16. A patient with schizophrenia is prescribed risperidone. The nurse should monitor the patient for which common side effect of this medication? Option A, granulocytosis. Option B, weight gain. Option C, hair loss. Option D, hyperthyroidism. The correct answer is option B, weight gain. When a patient is prescribed risperidone, an atypical antipsychotic, the nurse should monitor for weight gain as it is a common side effect of this medication. Weight gain can occur due to metabolic changes and. Question 17. In a patient with bipolar disorder, which symptom would indicate a manic episode? Option A, excessive sleeping. Option B, low self-esteem. Option C, decreased need for sleep. Option D, anhedonia. The correct answer is option C, decreased need for sleep. The correct answer is C, decreased need for sleep. A decreased need for sleep is a hallmark symptom of a manic episode in bipolar disorder. During manic episodes, individuals may experience significantly reduced. Question 18. Which therapeutic approach is most effective for managing borderline personality disorder? Option A, dialectical behavior therapy. Option B, cognitive behavioral therapy. Option C, psychoanalysis. Option D, supportive therapy. The correct answer is option A, dialectical behavior therapy. Dialectical behavior therapy (DBT) is considered the most effective therapeutic approach for managing borderline personality disorder. DBT is a specialized form of cognitive behavioral therapy that focuses on. Question 19. When patients diagnosed with schizophrenia suffer from anosognosia, they often refuse medication, believing that option A, medications provided are ineffective. Option B, nurses are trying to control their minds. Option C, the medications will make them sick. Option D, they are not actually ill. The correct answer is option D, they are not actually ill. Anosognosia is a lack of insight that affects patients with schizophrenia, leading them to deny or lack awareness of their illness. This lack of awareness often results in patients refusing medication because they. Question 20. Which patient should be most carefully assessed for fluid and electrolyte imbalance among those receiving the following drugs? Option A, lithium escalate. Option B, clozapine, clozaril. Option C, diazepam, Valium. Option D, amitriptyline. The correct answer is option A, lithium escalate. Lithium escalate is the correct choice because it has a narrow therapeutic index and is excreted almost entirely by the kidneys, making patients highly susceptible to fluid and electrolyte imbalances. Lithium. Question 21. A woman was abducted and raped at gunpoint by an unknown assailant. When found, she was confused and disoriented. The nurse makes the following observations about the client. She is talking rapidly in disjointed phrases, is unable to concentrate, and is indecisive when asked to make simple decisions. The client's level of anxiety can be assessed as option A, moderate. Option B, severe. Option C, mild. Option D, non-existent. The correct answer is option B, severe. The client's presentation, including rapid and disjointed speech, inability to concentrate, and indecisiveness, are indicative of severe anxiety. These symptoms suggest a high level of distress and impairment in. Question 22. Which statement by the patient indicates a need for further teaching regarding the treatment of major depressive disorder? Option A. I have been on this antidepressant for 3 days. I understand that the full effect may take weeks to occur. Option B. I am going to ask my nurse practitioner to discontinue my Prozac today and let me start taking a monoamine oxidase inhibitor tomorrow. Option C. I may ask to have my medication changed to Wellbutrin due to the problems I am having being romantic with my wife. Option D. I realize that there are many antidepressants and it might take a while until we find the one that works best for me. The correct answer is option B. I am going to ask my nurse practitioner to discontinue my Prozac today and let me start taking a monoamine oxidase inhibitor tomorrow. Choice B indicates a need for further teaching because the patient is planning to switch directly from Prozac, an SSRI, to a monoamine oxidase inhibitor MAOI without allowing for a washout period. This abrupt. Question 23. Which therapeutic communication statement might a psychiatric mental health registered nurse use when a patient's nursing diagnosis is altered thought processes? Option A. I know you say you hear voices, but I cannot hear them. Option B. Stop listening to the voices, they are not real. Option C. You say you hear voices, what are they telling you? Option D. Please tell the voices to leave you alone for now. The correct answer is option C. You say you hear voices, what are they telling you? The correct answer is C. You say you hear voices, what are they telling you? Because it employs therapeutic communication techniques that validate the patient's experience while encouraging further. Question 24. During a manic episode, which nursing intervention is most appropriate? Option A. Encourage group activities to increase socialization. Option B. Provide a structured environment with limited stimuli. Option C. Allow the patient to engage in physical activities freely. Option D. Give the patient detailed and complex tasks to complete. The correct answer is option B. Provide a structured environment with limited stimuli. During a manic episode, individuals may experience heightened energy levels and reduced impulse control. Providing a structured environment with limited stimuli is the most appropriate nursing intervention. Question 25. During a treatment team meeting, the point is made that a client with schizophrenia has recovered from the acute psychosis but continues to demonstrate apathy, volition, and blunted affect. The nurse who relates these symptoms to serotonin excess will suggest that the client receive option A. chlorpromazine, option B. phenelzyme, option C. haloperidol, option D. olanzapine. The correct answer is option D. olanzapine. In this scenario, the symptoms of apathy, volition, and blunted affect are indicative of negative symptoms commonly seen in schizophrenia. These symptoms are often associated with dopamine and serotonin imbalances.